Think of the human body like a massive, intricate engine. Billions of cells and miles of vessels, all firing in perfect sequence. But for an engine that complex to avoid tearing itself apart, it needs a master regulator to set the speed limit. That regulator is the thyroid gland, sitting right at the base of your neck. Its job is to continuously manufacture and release thyroid hormones into your bloodstream. These hormones act as the throttle for your metabolism, the chemical process that turns the food you eat into the energy you use. When that throttle is set perfectly, everything works in harmony. Your digestion, your body temperature, your heartbeat, they all hum along at a steady, sustainable pace. It is a highly delicate baseline. But if that regulator breaks and the throttle gets stuck wide open, the entire biological machine is pushed toward catastrophic failure. That stuck throttle is a condition called hyperthyroidism. Due to various triggers, the thyroid gland suddenly starts pumping massive, unnecessary amounts of hormone, flooding the system and plunging the body into absolute overdrive. The most common culprit is Graves' disease. It is an autoimmune condition where your immune system produces an antibody that effectively hijacks the thyroid, forcing it to overproduce. You can often spot it visibly. Patients frequently develop swelling behind the eyes, causing them to bulge outward. Inside, the physical effects cascade rapidly. Your resting heart rate spikes and becomes highly irregular. You experience severe weight loss, even if you are eating constantly. You sweat uncontrollably, your hands tremble, and you are flooded with profound, inescapable anxiety. Left unchecked, this extreme acceleration leads to a rare but highly lethal breaking point known as a thyroid storm. Triggered by a secondary stress, like an infection, the body's temperature spikes dangerously high, leading to rapid dehydration and eventual heart failure. Hyperthyroidism is a state of systemic breakdown, a metabolic engine running so hot it will shake the biological machine apart unless doctors can force a stop. To hit those brakes, doctors first have to prove exactly what is failing. They start with a simple blood test to measure the levels of thyroid-stimulating hormone, or TSH, along with the actual thyroid hormones, thyroxine and triiodothyronine. If the blood work shows an overflow, they need to see the gland in action. They use a radioactive iodine uptake test, or RAIU. Since the thyroid naturally absorbs iodine to make hormones, doctors give the patient a tiny, harmless dose of radioactive iodine and then use a special scan to watch the gland's hyperactivity in real time. Frontline treatments often involve beta blockers. These drugs will slow the heart rate down and ease the physical tremors, but they are only a temporary shield. They do absolutely nothing to stop the underlying flood of hormones. Even anti-thyroid drugs, medications specifically designed to block hormone production, are often not a permanent, long-term solution for severe cases. The moment the patient stops taking them, the overproduction usually returns. Masking the symptoms or temporarily suppressing the gland is just delaying the inevitable. To truly save the patient, medicine has to take radical, permanent action. This leads us to the central medical paradox of treating severe hyperthyroidism. The most effective way to permanently cure the disease is to intentionally destroy the very organ causing it. The primary method relies on the exact same biological quirk used to diagnose the problem. Doctors administer a dose of radioactive iodine, but this time the dose is much stronger. Because thyroid cells are the only ones in the human body that absorb iodine, they greedily consume the radiation. The overactive cells essentially poison themselves and selectively die off, leaving the surrounding tissue and the rest of the body completely unharmed. In cases where radiation isn't suitable, such as during pregnancy, surgeons have to go in and physically cut all or part of the gland out of the neck entirely. By eradicating the thyroid, modern medicine makes a drastic choice, electing for permanent, controlled destruction over unpredictable biological chaos to save the patient's life. Destroying the hyperactive gland creates an immediate new reality. The patient is instantly thrust into the exact opposite condition, hypothyroidism, or an underactive thyroid. Once the master regulator is gone, the body's metabolism crashes from a dangerously high peak to a near halt. Basic functions critically slow down. To survive, the patient must take synthetic thyroid hormone pills every single day for the rest of their life. This creates a unique clinical irony. Curing a runaway thyroid requires intentionally causing its absence, permanently tethering the patient's survival to a daily trip to the pharmacy. So why do it? Why is modern medicine willing to intentionally trade one life-altering disease for another? The answer comes down to risk. A hyperactive thyroid is highly volatile. It is capable of sudden, unmanageable spikes that can tear the cardiovascular system apart. It is an active, unpredictable threat to the patient's life. An induced underactive thyroid, on the other hand, is entirely predictable. While it requires a lifelong prescription, that medication allows doctors to measure, manage, and precisely control the exact amount of hormone in the bloodstream. Medicine cannot always perfectly repair a broken biological system. Sometimes the greatest medical triumphs lie in a strategic dismantling followed by careful artificial management. It replaces fatal volatility with clinical control, allowing patients to regain their balance and live long, healthy lives.